So we're here to talk today about the gut-brain connection and its role in autoimmunity. But first off, my name is Dr. Matthew Imber. I have my doctorate in chiropractic. I'm board certified in functional neurologist. There's only 11 of us in the state of Illinois and only 350 of us worldwide. I have over 600 postdoctoral credit hours in neurology, neurochemistry, neuroendocrinology, and neuroimmunology. So back to the gut-brain connection and its role in autoimmunity. So here's some facts about general autoimmunity. Autoimmunity is increasing every year, and at a kind of a dramatic rate. We see these jumps between generations, so we know it's not just a genetic component, but there's environmental factors at work. Most cases of autoimmunity are actually not diagnosed, so we actually don't have exact figures of how prevalent autoimmunity even is. Most cases of autoimmunity will continue to progress over time and actually develop into more and more autoimmune conditions. And there's no known cure for autoimmunity. Though the symptoms can be managed effectively, there's not a way to actually get rid of the autoimmunity permanently. So let's go into a bit how autoimmunity works. Autoimmunity has to do with an overactive immune system. So let's back up and kind of explain how the immune system works with things entering your body. So you have two parts of your immune system. You have the Th1 and the Th2 system. And this Th1 and Th2, they kind of work together kind of like an army and a navy to fight any kind of foreign invader into your body. You get a virus, you get a bacteria, whatever it is, this Th1, Th2 immune system works together to get rid of it. What happens with autoimmunity is the scale gets tipped. Either Th1, in this case, or Th2 is possible, becomes overactive, becomes the dominant force. And when that happens, you start attacking your own cells. So when you get like a flu virus, when you get a cold, your body makes a wanted poster for that cold. That's why you only get the one cold once. That's why you only get chickenpox once. That's why you become immune to things, because you create this wanted poster and these cells carry it around. What happens with autoimmunity is you create a wanted poster against your own tissue. So instead of having a wanted poster against a virus, you actually have it against, like say, a joint cell if it's rheumatoid, or a thyroid cell if it's Hashimoto's. And you start attacking the cell. So after a while, after you've been attacking these cells for a long time, your immune system thinks it's working, because as it destroys cells, your body makes more cells. And with like a virus, for example, it uses your own cells against you. How a virus replicates is it goes into your cell, produces new viruses in your cell, and uses your cells against you. So your immune system goes, hey, I'm losing this fight. I need to make sure this virus doesn't use my own cells against me. And it starts destroying its own cells. It starts creating inflammatory reactions that start breaking down cells. This is where you get like joint loss with rheumatoid. This is where you get the villi atrophy with ulcerative colitis and Crohn's, atrophy of the tissue. So what causes this Th1, Th2 scale to shift? So we know, what happens with this. There's a cascade. Th1 or Th2 becomes dominant, leads into Th17. But what starts this? Where does it all begin? And this is the real question that we have to figure out. So the literature reflects that intestinal permeability is necessary to develop autoimmunity. Now, intestinal barrier function decrease is referring to leaky gut. That's what they're talking about here. So literature is saying that leaky gut has to come before an autoimmune disease is developed. And this is just more literature here showing that, yes, it's this breakdown in this the gut lining that causes this. Well, why is the gut such a source of autoimmunity? And that's because 70 to 80% of your immune system is in your gut. That's where these responses kind of start. That's a big part of your overall immune system. So what is leaky gut? How does leaky gut kind of happen? So if you look here, this is your stomach in here. Your stomach line is only one cell layer thick. And as far as your body is concerned, this area right here is actually outside of your body. From your mouth to the other end is all considered external. And what should happen is you have these big food molecules that come in, you break them down with your digestive enzymes, and then these cells actually come up and they grab these little molecules and they bring them through the cell into the bloodstream. What happens with intestinal permeability is, let's say you don't digest dairy very well, and you ate some dairy, and that's sitting here not digesting, and this causes an inflammatory reaction. and that inflammatory reaction causes a breakdown between these tight junctions. And then food that should never have been in your bloodstream, that should have always stayed out here, starts to sneak into your bloodstream. And your immune cells in your bloodstream see these guys and they go, hey, who are you? You're not supposed to be here. So they start attacking them. They start thinking they're foreign invaders, they're virus or bacteria. This is where food allergies come from, and this causes a big inflammatory reaction right here. And what happens is you have that local immune reaction that increases more intestinal inflammation, which causes more widening of those tight junctions, and this creates kind of like a feedback loop that gets worse and worse and worse. And as this is happening, you're getting more and more food allergies or sensitivities. No one's born allergic to 50 things. This is something that develops over a long period of time. Furthermore, when those tight junctions are broken down, that actually releases an enzyme called zonulin. And zonulin actually increases permeability in the brain, blood-brain barrier as well. Just like your stomach is considered outside your body, your brain tissue is actually considered like its own little environment and is walled off from the rest of everyone. And this breakdown lets things get into that neurotissue that causes inflammatory reactions there as well. So now this isn't even related to autoimmunity. These are just other symptoms of actual leaky gut. And I mean chronic fatigue syndrome, depression, chronic inflammatory conditions, chronic pain, inflammatory bowel syndrome, obviously autoimmune disorders like we're talking, multiple food sensitivities that we just explained, bacteria and yeast overgrowth, brain fog. And this is before the autoimmunity even starts. So let's say, that predisposal to autoimmunity, leaky gut. You have leaky gut, but it hasn't grown into autoimmunity yet. You could still be experiencing all of these individual symptoms. And here's kind of where we start to look at how the brain plays a role in this. So everything involved with digestion is controlled by the brain, including release of digestive enzymes, gut motility, and just the shunting of blood to the stomach. All these things are involved with digestion, and they're 100% controlled by our brains. So our brains fire down in what's called the vagus nerve. The vagus nerve kind of what controls our rest and digest functions in our abdominal area. The technical term for this rest and digest functions is your parasympathetic nervous system, which is in contrast to your sympathetic nervous system, which is your fight or flight nervous system. So when you decrease this vagus, which is from decreased activation of the brain, you're going to get decreased intestinal blood flow. So why this is important, you actually don't have enough blood in your body to run everything at once. So let's say you're running, you shunt blood to your legs. Let's say you just ate a big meal, you're going to shunt blood to your stomach. And this is what helps you digest things. This is the same reason, like if you stand up quickly and you get a little dizzy, you're not shunting blood to your brain correctly. This is the same process. The actual movement of the gut to move things through your stomach is controlled by the brain. If this isn't happening, food sits there, starts to putrefy, starts to ferment. That's what gives you that bloating feeling. You get bacteria and yeast overgrowth. You start reacting to pretty much everything you eat. Get that nauseous feeling after you eat food. And then you start getting immune responses as well. And all of these lead kind of intestinal permeability, and like we talked about earlier, intestinal permeability leads to autoimmunity. And this is kind of just a brief overview if we see how decreased brain function leads to autoimmunity. So you'll see with all these studies, they talk about traumatic brain injury. And this is due to the fact that with traumatic brain injury, we can see a brain working well, and then we can see it afterwards. So we really can compare, what effect does the brain have on the body. And here you see the literature reflects that traumatic brain injury causes gastrointestinal dysfunction and increased intestinal permeability, leaky gut. And regulation of the gut barrier involves the central nervous system. So just, digestion itself involves it, but the actual stomach lining itself is regulated by our central nervous system. Here again, you see traumatic brain injury can lead to several physiological complications, including GI dysfunction, specifically leaky gut. Again, brain injury leading to GI issues, which leads to inflammation, which is going to lead again to leaky gut, ultimately resulting in food allergies and autoimmunity. So the gut-brain connection, and we don't just see this in autoimmunity, we don't just see this in leaky gut. There are a lot of instances where we see the brain function and our digestive function leaked. For example, Parkinson's. Parkinson's, decades before you get any of their symptoms, you're going to lose your smell and constipation. You're going to start having constipation. Smell is extremely linked with digestion. And smell is one of the first things to go in a lot of neurodegenerative disorders. Smell fires directly into our frontal lobes. Our frontal lobes are fire into what's called our PMRF, which controls our autonomic nervous system. That sympathetic and parasympathetic controls our fight and flight and rest and digest. With young kids, we see the ability to walk and talk and eat solid foods as being impaired. As their brain starts to increase and they're able to, move around and have more cognitive abilities, their ability to digest more complex things is increased. ADHD kids have a high percentage of bedwetting, and that's just because of that, urination is part of digestion. And that's, again, linked with that upper brain function. Alzheimer's, just the same as Parkinson's, lack of smell and constipation. TBI and digestive issues we just talked about. Another important thing with traumatic brain injury, also, concussions under that umbrella of traumatic brain injury, is when that happens, you get what's called glial cell activation. Those are the immune cells in your brain. So they become active, and that's actually what causes all the symptoms of concussion. So now if you, let's say, have leaky gut, and you develop a food allergy, and then with that leaky gut, you have the release of zonulin, and that increases blood-brain permeability. And now you have that inflammatory response, which causes more inflammation in your brain. You can actually reconcuss just by different foods you're eating. And then finally, we see vestibular issues and nausea. Now, vestibular system refers to your sense of movement. Like you go on a tilt-a-whirl, you spin around, you get nauseous. That's because these parts of your brain are intimately connected with the brainstem, and the brainstem is where you control most of your functions that you don't have to think about. And we've been talking about just the brain's role in autoimmunity. We haven't really talked about, okay, well, is there anything else that plays an impact? And obviously the answer is yes. There are many other systems that are closely at play when it comes to autoimmunity. Your adrenals. Your adrenal glands are what control cortisol. That's your stress hormone. This is going to control your sleep-wake cycles. There are very few things that are more detrimental to your body than stress. Stress can literally atrophy every single aspect of your brain. It can create intestinal problems. It can create immune problems. Another thing is environmental toxins. And we see this a lot with people in specific industries. If you're in more an industrial job, like cosmetic industry, like hairdressers are exposed to a lot of toxins, people in the cleaning industry, and this can really break down that immune system. Now, when you're reacting to everything, like the smell of perfume or cologne or, cigarette smell, all those things just kind of light you up, that's usually something called tilt, which is toxic-induced loss of tolerance. What this means is that your immune system is so compromised and you're in such inflammatory levels that you're reacting to anything that comes in. Blood sugar is another huge aspect. There's literally almost nothing that can't be affected by blood sugar. Blood sugar is so crucial for neural function, for gut function, for each individual cellular function. Obviously, we talked about how concussion plays a big role. Hormones is another big aspect. We kind of ignore hormones with autoimmunity, but hormones control a lot of our body's functions. From, like our stress response with the cortisol hormone we talked about, to the fact that estrogen codes for glutathione, which is the most endogenous antioxidant. We have to consider hormones when we're considering the overall health of someone's body, their brain, and their immune system. And chronic infections are another big player, whether this is like you have cold sores and you have HSV1 and that's a chronic infection, or Epstein-Barr. When these go on for a long time, they really put a drain on the immune system and they leave for susceptibility to developing autoimmunity. So the question is, what do we do about it? This is all well and good. These are all the things that are going on. But when it comes down to it, what can we do right now for your autoimmunity? And the answer is we can't just do one thing. What we do for person A's autoimmunity is not the same what we do for person B's autoimmunity. We have to look at the person as a whole, and there's not just one protocol. And this is where autoimmunity gets mismanaged a lot in the medical community. We're always looking for standards of treatment. A patient comes in with this, do this, this, and this. But autoimmunity, your immune system could be driven by a food allergy. It could not be. It could be mercury from a filling. It could be some toxic environment at work. It could be just, a concussion you had leading to decreased brain function. And we have to kind of look at all factors of your life. There's these things that happen all over us that we think of, I have a little harder time finding words, my memory's a little slower, I'm not as awake as I used to be, and we think of all these as different issues, but quite commonly they're all connected, and we don't consider that a lot of the medical community. We look at, okay, we're going to look at your brain, and this doctor's going to look at your gut, and this doctor's going to look at your ability to move around. And we never really correlate those things together, but they are so intimately connected. I can't tell you how many times we have patients come in and they list off all these things. I got this going on, and this going on, and this going on. And they go, everyone tells me it's all in my head. And I go, I usually agree with you. That's where your brain is. Your brain is what controls all these things. This is the common connection between all these symptoms. So how do we figure out what's going on? And one of the key things the most important thing is proper testing. We have to objectively find out what's going on with you. We have to look at things as a whole, but we have to look at that in a concise and objective manner. So the first thing we're going to start with is a Chem Panel Plus. So most people had a Chem Panel. This is like your white blood cells, red blood cells. So the average is about 24 markers. We run about a 49 marker panel depending on the individual. We have to look at things like vitamin D level, inflammatory markers, and a whole host of other things, especially depending on different individuals. But we talked about before, hormones. Hormones are super important. The best way to test for hormones is saliva testing. Hormones bound better to saliva than they do blood. Stool testing here refers to checking for chronic infections. We want to see if there's any gut infections going on. We want to see if there's any parasites that are causing more GI unrest. Organics, this is referring to more cofactors, things in what's called your citric acid cycle. This looks at the production of ATP. ATP is what you use for energy. Let's say, if you think of your body as a carnival and you want to move your arm, that costs 3 tickets. You want to think about something, that costs 5 tickets. These tickets would be ATP. Food allergy testing, obviously with intestinal permeability being so important, we have the test for intestinal permeability itself. We also have to see, is there any food allergies? And if there are, we have to remove those things from driving that immune system. And just like you can react to food, you can react to different chemicals. Like in face soaps, those little balls that are in them, you can be reacting to those. And we can actually run blood work to see, are those being affected? And, another big thing is the neurological testing, like we talked about. The brain controls everything. For example, your left cortex controls your immune system. So a lot of times we see people come in with a dominant left cortex versus their right cortex, which is driving an increased immune response. So we have to look at the neurological system. And finally, the thing I don't have listed here that's so important is just listening to the individual. I can't tell you how many times people come in and they tell us everything we need to know. They go, I have this going on and this going on, and it's so helpful. And they tell us, I've told everyone that. And no one's just kind of taking the time. You have to kind of hear it from your perspective. That's why when you come in, we try to spend a lot of time with you right from the start to really know what's going on. So, if you have autoimmunity, why haven't these tests been run on you before? We see it all the time. People come in and go, well, I've had autoimmunity my whole life and I've been everywhere. How come no one's mentioned any of this to me? And a big part of that is in the medical community, people don't do anything that doesn't dictate treatment. So if you don't know how to interpret these tests, if you don't know what you would do from these tests, then why would you run the test? And the reason people don't run it too is there's no prescription that treats most of these things. Not like, prescriptions aren't effective. No, there isn't one that even claims to do this. So we have to kind of think outside the box. We have to use whatever's available to kind of get you better. And this kind of leads us into our next part, which is we treat from a holistic basis. So now what is holistic? We always hear holistic and it's kind of misused today. Holistic today tends to mean anything weird. Oh, that's really weird. I've never heard of that before. You must be a holistic practitioner. But that's actually not the definition of holistic. Holistic is, like it sounds, a little bit of everything. You're taking parts of all parts of medicine, whether it's, allopathic, chiropractic, nutritional, neurologic, homeopathic, naturopathic, whatever's available, use whatever's best for that patient. So if patient A comes in, and this person needs to do this, and maybe needs to get surgery or whatever's necessary, we have to use whatever's available to get that person better. We can't, be stuck in our ways and go, well, I only treat this way, so I'm going to treat every patient this way. If all you use is a hammer, all problems start to look like nails. You have to be diverse. You have to use everything that's available to get that person as healthy as possible. So let's kind of review of what we have to do to address the underlying cause. And this is really an important part. We can't just treat symptoms. You know, if you have autoimmunity, you're going to have tons of things going on. If we're treating just symptoms, we're going to end up treating 50 to 60 different things. That's why you see these autoimmune patients come in and they're on like 30 different medications, because if you're treating the symptoms, you're just chasing things down left and right. So if we're going to treat that underlying cause, or if we're going to treat what's actually causing the symptoms, we have to identify what's driving the Th1 and Th2 imbalance, and we're going to do this through proper testing, that blood work we talked about a little bit ago. And then we're going to remove whatever we've identified, whether it's environmental toxins, chronic infections, food allergies, nutrient imbalances. We're going to fix whatever we find. And then next, you know, that intestinal permeability is necessary for autoimmunity. We have to make sure it's stopped. You know, if you unfortunately have, you know, several food allergies now, we don't want any more in the future. We want to stop with whatever we have. So we have to stop that intestinal permeability. We have to stop those food molecules getting into the bloodstream, driving the immune system. And that brings us to the next part. We have to get the immune system under control. That's what's really causing your symptoms, is the immune system. It's not your thyroid that's causing the Hashimoto's symptoms. It's your immune system attacking the thyroid. So we talked about some of the factors that drive that immune system. We have to look at those. We have to correct the neurological deficits. And we do this through functional neurology and neurofeedback. Functional neurology, we use functional methods to fix parts of the brain. Let's say we see your right cortex is firing weaker than the left cortex, like we talked about before. We can actually do exercises that stimulate that right cortex and objectively measure that to make sure we're making progress. With neurofeedback, we use an EEG system to actually measure the brain waves that the brain is producing, and we can actually modulate those brain waves through feedback loops. And finally, we repair the tissue that's damaged. So let's say that you've had, you know, a thyroid autoimmune disorder. If that thyroid's being attacked, being eaten away, or, you know, you have IBD and that gut tissue's been eaten away, you know, we remove what's causing the damage, well, we also have to repair the damage that's already been created. So, it's anyone with autoimmunity, this is so important. We have to create neuroplasticity. That's long-term changes. That's what we're doing in the neurological aspect. Another important aspect is patient education. Like I said, autoimmunity is for life. And even if you're symptom-free, it's always going to be there. It's always going to be a part of you. And you have to be your own advocate. You know, we're really big on patient education. Obviously, you can see from these videos. And when a patient comes in with autoimmunity, we give them a whole binder of information. And we give them their labs, and we go over them labs, and we explain everything we're doing with them and why. Because they need to be involved in the healing process. They can't just idly sit back. You can't go, I have an autoimmunity, woe is me, someone get me better. You have to be involved. You have to be proactive. You have to take the steps forward. And we want to give you the tools you need to do that. And we do these through evidence-based practice. We're not doing things that are based on our opinions or we think are right. We're using what's most current in the literature. The average medical treatment across the board is 40 to 50 years behind the current literature. That means what you're getting done at most medical offices has been outdated for 40 to 50 years. And you see this with autoimmunity. You look at what were doctors doing for thyroid patients 30 years ago. Almost identical to what they're doing today. We don't do this. We are passionate about keeping up with the literature. We're passionate about doing whatever is most up to date. How we treat an autoimmune patient today is different than how we treated them 6 months ago. And we're going to continue to change. And we're going to change every time more literature comes out. And we have to just grow with the literature and use the best knowledge that's available. And most importantly, long-term changes. You know, it's great to feel good today, but I want you to feel good for every day from now on. We have to make changes that are permanent and long-term. And this does involve patients being proactive. I can't go, you know, take this pill, take this supplement for the rest of your life and feel great. You know, there are things that you have to be involved with. There are changes you have to make sure these changes are long-term and permanent. So this is kind of our overall perspective of autoimmunity. You know, we encourage people to have questions. We encourage people to go, how does this apply to me? You know, obviously we talked about in general, it's hard to do a lecture for each individual person in the world. So what we offer, because, you know, autoimmunity is such a long-term thing and such an intimate connection with whoever you're treating, is we'd like to offer people a free 15-minute phone consult. We kind of do this for both of us, just to figure out, you know, is this a good fit? Or, you know, are we on the same page? Is this something that, you know, you're willing to make the steps forward? And are these the steps that you want to take? And we do the phone consult because you don't have to come into office. It's literally just commitment-free, getting to know each other. And this is the point for you to ask questions about your own individual autoimmunity and how what we do relates to you. So thank you for listening today, and we look forward to hearing from you.